stage 4 lung cancer once came with limited options, but recent medical advances are transforming how we approach this diagnosis. Today, new treatments are offering patients more hope and improved quality of life.
Stage 4 lung cancers have undergone a dramatic breakthrough in treatment over the past decade. Previously, 10 or 15 years ago, all these cancers would be treated in the same way, that is with chemotherapy. Subsequently, research told us that lung cancer is not one disease, but it is of several different types. We now know that several lung cancers happen because of certain mutations in the cancer DNA, and these are known as driver mutations. The most common mutations that happen are the EGFR, ALK, ROS, MET, and a few more mutations. So in one analysis, in Indian patients, out of around 500 lung cancer patients which were analyzed, it was found that 60% of patients had a driver mutation. So the good news is that patients who have driver mutations can be treated with targeted therapy medicines, which are tailored to attack those cancer cells carrying this abnormal mutation. Now, because this is a targeted therapy, the side effects compared to chemotherapy are lesser, and the patient's quality of life is superior, and even their survival also is superior than patients who are treated only with chemotherapy. On the other hand, patients who do not have driver mutations in their tumor DNA, there is a new treatment development which I'm sure all of you have heard about called immunotherapy. So in these patients, we do a test known as PD-L1. This is a marker which is tested on the biopsy sample, which the results of which we get in 2 to 3 days. And based on this PD-L1 expression in the cancer cells, we understand how well this patient is going to respond to immunotherapy. Patients who have a very high expression of PD-L1 on their tumor cells, and this is typically in patients who have been heavy smokers in the past, these patients tend to respond very well to immunotherapy, and in fact they can even avoid chemotherapy because immunotherapy drugs work so well. Thereby they avoid the chemotherapy side effects like hair fall, fatigue, nausea, vomiting, etc., and they have a better quality of life and even a longer survival. Patients who have a lower PD-L1 expression in the cancer cells, they are treated with a combination of immunotherapy and chemotherapy. This further helps them to achieve better survival and long-term survival chances than patients who are treated only with chemotherapy.